this week on the American Health Journal. COPD is a group of progressive debilitating lung diseases and is the third leading cause of death in the United States. A new and innovative treatment using a patient's own stem cells is helping them regain their quality of life. New York-based Dr. Prabhat Soni discusses COPD and these promising new therapies.
COPD, as the name stands, chronic obstructive lung disease. This is a group of pulmonary diseases like asthma, bronchitis, emphysema. What happens in COPD, it's a chronic problem. It's not reversible. Once the damage is done, it's done. You end up in emphysema or pulmonary fibrosis. There is a chronic inflammation that is part of chronic bronchitis, and destruction of alveolar tissue that end up in emphysema. That is considered a dead lung. So basically, it's a very serious, dangerous disease. The symptoms of COPD are chronic cough, wheezing, production of sputum, and short of breath. When they walk, some people are short of breath at rest, depending on how bad you are. For COPD, there is no cure. The treatment only controls symptoms, but we have a good news. Now we are using stem cells to repair and regenerate lung tissue. That is something will change the whole future of medicine. And over time, growing lung may be cheaper than transplanting lung. Only stem cell can grow lungs. It can reverse the process of destruction. One of my patients, around 40-year-old female, she had asthma from childhood. She used to go to ER, emergency room, every month, and she was intubated like 10, 15 times in the last 10 years. So she was on maximum medications when I gave her stem cell treatment. After getting 3 treatments, it's almost 3 years now. She has not gone to hospital anymore. No more ER visit, in 3 years right now. And she is using only minimum medication, only 1 pump just needed. Stem cell can be given intravenous or by inhalation, just like you're nebulizing your asthma medication. And they work from inside and outside of your lung. Cruz is a bodybuilder. He has asthma from childhood. He is on all kind of medications. Sometimes he really need prednisone to suppress his asthma symptoms because he can't work out.
I'm an NPC athlete. I've been doing a bodybuilding show for the past 7 years. For me, it's kind of tough because I'm asthmatic, and in the allergy season, it's really bad for me. They start with the allergies and go to the asthma. And I want to give it a chance. He helped me.
We are giving him stem cell treatment by nebulizing, and we will see how he will improve.
I feel a lot better. I feel like I can clean everything inside, can breathe much better, much deeper.
Until now, the stem cells are being used in various medical conditions like osteoarthritis, wound care, diabetes, pain management, but now doctors are using for COPD, and it's showing good result, and we see very promising future for COPD patients.
You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors.